Well, we move now to the American Cancer Society's annual report. It's out today, and it has new statistics about nationwide cancer rates.
Yeah, prostate cancer, the second leading cause of cancer death for men in the U.S., has increased by 3% every year from 2014 through 2019. And it's prompting the ACs to kickstart a comprehensive initiative to bring down the number of deaths. Here to help us make more sense of this is NBC News senior medical correspondent Dr. John Torres. Dr. Torres, always great to see you. So tell us, what's some of the key data on prostate cancer in this report, and why is it? Do we have an idea about why this is happening and that the mortality rate has gone up?
So what they found out is over the last decade, they found that, like you mentioned, the cancer rates are actually going up around 3%, and the advanced prostate cancer rates are going up between 4 and 5%. And a lot of experts are pointing towards what they think is the advice we've been giving on PSA testing, because if you remember back in 2012, PSA testing changed to where they said, most of the time you need to have a discussion with your doctor. In 2018, they made those recommendations a little more concrete of not everyone should necessarily go through a PSA test like we did years ago, decades ago, where if you reached a certain age, you got a PSA test. But instead, they said everyone should sit down and talk with your doctor. If you're at higher risk, then you're more likely to get the test. If you're not, then you're less likely to get the test. And experts are saying because we're not testing as much, those advanced cancer rates and those cancer rates are going up, which is leading to higher mortality rates as well, Vicki.
We're not catching them in time. So talk to us about the new initiative against prostate cancer that the American Cancer Society is now launching. What do they want people to do?
So they're starting this initiative called IMPACT, and it's improving mortality from prostate cancer together. And the reason they call it together is because what they want to do is use essentially this holistic approach, and they're using clinics, they're using laboratories and communities to try and address what they think are the shortfalls right now. And the main thing is, yes, as a doctor, it's easy for me to say, go in and discuss with your doctor whether you should get a PSA test or not. And if you do get a positive PSA test, discuss with your doctor what needs to be done after that as far as following up to find out if it's a cancer needs to be treated or not. But as a patient, that's not always that easy to translate. And so they want the communities involved so they can get experts out there into the communities telling people what they need to talk to their doctors about so they can have a better understanding of whether they need to get the PSA test or not. And if they do get the PSA test and it's showing positive, where they need to go from there.
All right, and really quickly, what's the prognosis if you do catch it early? It's a pretty survivable cancer.
And yeah, it depends on a variety of things, including your ethnicity. We do know that black men have a higher rate of prostate cancer and a higher death rate of prostate cancer. And we also know that the more advanced stages and the less it's caught in those advanced stages, the less early it's caught, then the more likely it is it can be hard to treat. And so it can be at that point where it can be an issue to treat. And so getting an early treatment, getting an early diagnosis is important, and that's what this is addressing.
All right, Dr. John Torres, thank you so much, Dr. John.